Welcome to episode 14 of the Lymphatic Massage Therapist Book Club, and we're looking at chapter 14 of High Definition Body Sculpting. This is the female dorsum, flanks, and hips chapter. So definitely a great read to familiarize yourself with the plastic surgeon's viewpoint on this surgery. So you can know what is happening to your clients before they end up on your table. And I'll just point you to page 161. And actually we need a picture of to show. You'll see that there's a red area and then a green area on the back of the female torso. And now I have to see liposuction, they say on page 161, between the red zone and the upper gluteus muscle needs to be performed gently. Over resection of this area can be detrimental because it can masculinize the dorsum. The gluteal area must project sufficiently and extend appropriately to give a natural and beautiful result. If the upper pole of the buttock is inadvertently resected, it is very difficult to correct since it will need repeated fat grafting. And then it says there's a long learning curve and proper training is essential in order to avoid overcorrections. So this is kind of an idea of if you see that maybe they're frustrated because they didn't get the results they absolutely wanted to. If it has to do with this red zone here, this is really a time where you can take a minute while they're on the table and explain to them why the surgeon didn't go as hard and carve them out as deep as maybe they wanted to. Because though they look swollen now, the eventual result, we want to have a nice even curve, because if they cut it in too much and remove too much fat in that area, that they would end up looking more masculine if they indeed wanted to have a more feminine look. So that's really, it's interesting, and it's something that I'd never really thought of clearly before, and that's another reason why, again, I say this in every chapter, I really like this, I really like this book. And then just on page 163, they go over much of the same post-operative care that they did for the male, including padding is left on the sacral area for extra compression. A foam vest and compression garment over the waist and torso are important for smooth, even skin retraction. So that is specifically a foam vest and a compression garment over the waist and torso, talking about skin retraction. So I note that in a book that I wrote a few years ago, that it really is the compression garment and the foam will help with skin retraction. And just this is another role that I'm taking as a therapist, letting them know, because often I'm seeing them more after the surgery than their plastic surgeon is. So they're going to get this question to us before they would, get it to their plastic surgeon. And week to week, they are going to feel more and more irritated at having to do the garment and the foam, and reminding them if they really want optimal skin retraction. Now I've seen it in multiple sources from plastic surgeons that the key really is the foam in the garment. So that's something we can go over with them on a week-to-week basis when they're when we ask them when they come in, are you wearing your garments? Are you wearing your foams? Like, how are you feeling? Just giving them that gentle reminder that wearing the foam in the garment is essential for skin retraction, which is what a lot of clients want, especially if they've had the Lipo 360 and they didn't want to go all the way to get the tummy tuck. They are definitely looking for skin retraction after the surgery. Okay, have a good day.